The zoning division saves customers some legwork. Customers visiting the Pinellas County Zoning Division to obtain a zoning permit or zoning information have had their lives made a bit easier due to a time-saving idea conceived by the Zoning Division staff. Citizens, unaware that a legal description of their property was necessary to obtain a zoning permit, would often arrive at the zoning counter without the required documentation. In the past, if all of the technicians at the counter were busy and unable to call over to the property appraiser's office, the customer would have to walk across the street to visit the office personally. In an effort to serve their customers better, the Zoning Division had a separate inter-office telephone installed at the counter for customers' use. Customers can now call directly over to the property appraiser's office to obtain the necessary legal descriptions. This new procedure has not only benefited the customers, but also the zoning technicians. It saves time by speeding up the permitting process.
Hi, my name is Cheryl Collar-Reed. I work for Community Development and I am a team leader. As you've just heard from Fred and seen in the Q examples, a lot of great things have happened since the start of our quality improvement process in Pinellas County. Team leaders are being trained in a 7-step quality improvement process. This process will help us select and effectively solve problems that need our attention. We use this process to solve problems that are reoccurring, costly, and difficult to solve.
Fairfax County. Beautiful and poor. Affordable housing is a common problem among the poor and working class families. At least 50,000 people in Fairfax County live in households whose incomes are less than $15,000. Today, an average 2-bedroom apartment rents for about $700 per month. The average cost of a new home is nearly $200,000. And at least half of the $15,000 income will be used for housing. There isn't much left over. Consequently, hard choices are often made between rent, food, and medical attention. The good news is, health care for indigent Fairfax County children is a priority for a great many people who can help. And a public-private partnership is working to deliver medical attention to needy children across Fairfax County. Designed in 1986 by the Fairfax County Department of Community Action, the project currently reaches about 1,000 for the estimated 19,000 uninsured eligible children by providing health care scholarships. The DCA, with its growing number of partners, is confident of completing the mission it launched 4 years ago. The mission of serving 19,000 children by the year 2000. Who are the partners? Fairfax County government through the DCA, the medical community, and the private sector community led by First American Bank. Much of the program's success is indebted to the compassion of 200 doctors, 2 HMOs, 7 pharmacies, 3 labs, acute care center, and 52 dentists who donate the majority of their time and help defray the cost of delivering quality health care service. Even so, providing health care remains an expensive endeavor. Private business steps in to help underwrite medical scholarships and to organize fundraising among other local companies. The partnership is working. The DCA has been the recipient of 4 national awards for its innovative approach to a serious problem.
Our goal is to deliver quality health care to the county's indigent children between the ages of 1 month and 18 years of age. Thanks to the volunteer efforts of local doctors and businesses, we are making a difference.
We've shown you some figures, illustrated that poverty does exist in our beautiful county. But poverty can't really be understood by just looking at the numbers. It's a personal experience. As a parent, I know what it costs to provide housing, food, clothing, utilities, and childcare. Any parent can tell you that providing for just the essentials adds up quickly. For the impoverished, there isn't anything left over. We can understand any parent's pain at not being able to provide for their children.
Our assistance is crucial for many families who are working toward economic self-sufficiency. They've almost made it, but a lack of affordable medical care or a serious family illness is holding them back. When we can provide a health scholarship to such a family, we are helping them get on their feet and on the road to independence.
Operation Hand Up began when Mayor Fozzie, the state of Hawaii, and the Hawaii Ecumenical Housing Corporation got together to establish a facility for the homeless.
Basically, we are proposing to renovate an existing building on state-owned property where single homeless people will receive shelter and one hot meal per day, employment opportunities, job training, and other necessary support services to be provided by a private nonprofit agency. We in-house will build 40 8-by-8 rooms. Every single person will have his own room. The building is divided so it can accommodate single women as well as single men. You'll have an administration office here. You'll have a kitchen facility in this area, toilet, laundry facility in here for both men and women. So altogether, we can handle 40 single people.
The city and county of Honolulu provided carpenters, electricians, plumbers, and painters to renovate an abandoned warehouse located at Pier 40. The state will pay the rent for the planned 6-month project, and the Hawaii Ecumenical Housing Corporation will manage the facility. On August 14th, the new homeless shelter was dedicated and the public was invited on a tour.
This shows you what you can do when everybody works together. And I'm talking about a real team effort with all the city departments, the fire department, the police department, the city employees, the Hawaii Ecumenical Housing Corporation folks, working as a team. In 10 days or a couple of weeks, we put this project together. Not too bad. And I want to give a hand to all those folks. Thank you very, very much for all the extra time.
The bottom line is, yeah, I gave the okay to move. We got the okay from the state. Jeremy handled all of the personnel. But the bottom line is that without the people who actually did the work, we would not be here today to celebrate really an auspicious occasion. And we think that any and all people have an opportunity to better themselves with this program. This is not just housing for somebody. That's not enough. We're saying we want to help you. We want to make sure that for $200 a month, that you have the accommodations that you have plus one free meal a day to go with it. At the same time, we're saying to them, we're going to try to get you a job. We're going to pay half your salary to whoever hires you for 3 months or up to 6 months, whatever it takes. And to others, to place them. And those that can't be placed, those that want an education, to help them along. This is a people's program. This is not just a program to take care of somebody for the time being. We want these people to better themselves. That's why we have 40 units. I wish we had 40 such buildings as this, because we can accommodate these people and say there is hope. This administration is not going to sit back for anybody, whether it's government, bureaucracy, or whatever. Whatever we can do to help the homeless, we're going to help them. I know because I was homeless when I was a young boy in a big depression. So I know where these people are coming from. You work with us, we'll work with you, and get the naysayers out of the way. Get the politicians out of the way. We'll get the job done. That's our record and that's our promise. Thank you all for showing up at this very, very important occasion.